Good evening, my people. We are still discussing about our fibroids, and more specifically, we are in the one type which is called Subsrosal fibroids. And before we continue, let me appreciate you people for the support you have given me so far. Thank you for the subscribing. Thank you for the likes. Thank you for the comments. And it's my hope you will keep the support on. Let's get back to our point of discussion, whereby we will be looking at the medications which can be used in the management of fibroids and what is their use in those patients having fibroids. So medications don't cure fibroids, but can help manage fibroids and symptoms. So the medications we are going to look at, they don't necessarily cure the fibroids, but manage the complications brought about by fibroids. Or rather, or in other words, they just relieve the symptoms. Number one, we have what we call hormone therapy, or oral contraceptives, or you can just say OCS. So in hormone therapy, the first point we are going to look at is the oral contraceptives, sometimes called the OCS. These are used to control heavy menstrual bleeding, which is used usually as a result of fibroids, but do not shrink or cure the fibroids. Number two, we have progestin releasing intrauterine device, or IUD. So for fibroids that are in uterus wall rather than its cavity, so fibroids in the uterus wall rather than the uterine cavity this IUD or progestin releasing intrauterine device can be used to relieve bleeding and pain, but does not shrink the fibroid. So it relieves, it reduces the heavy bleeding and somehow relieves the pain which occurs as a result of the fibroid, but it does not shrink or cure the fibroid. Number three, we have gonadotrophin releasing hormone, or GnRH agonists. This lowers estrogen and progesterone levels, stopping menstruation. It stops menstruation because through menstruation one loses a lot of blood. So by using this gonadotrophin releasing hormone agonists, menstruation stops, and this helps in stopping the bleeding, which might lead to anemia. So it stops the menstruation, but it does not shrink or cure the fibroids. Note this, it can be used only for a few months. It cannot be used for a long time. Let's discuss about non-hormonal therapy or medication. Non-hormonal. Above we have discussed about hormonal therapy, and now we are discussing about non-hormonal medications which have no hormones, or are not hormone based. These are non-steroidal anti-inflammatory drugs, for example Brufen, and these treat cramping or pain caused by fibroids and does not shrink the fibroids. It just relieves the pain caused by the fibroid, but it does not cure or shrink the fibroids. We have tranexamic acid. This helps to boost the clotting time, or to boost the clotting ability of the blood, thus decreasing vaginal bleeding. It's used in severe circumstances such as heavy bleeding, and it's not used as a long-term method. It does not shrink the fibroids. It just helps relieve or reduce the bleeding to avoid anemia, but it does not relieve pain, and also it does not shrink the fibroid. So through transnamic acid, you are able to control bleeding, which can lead to anemia. Let's look at the prognosis or the complications which can come about as a result of fibroids. One, we have severe pain or heavy bleeding and may require an emergency surgery. Number two, we have twisting of fibroid, which may also require surgery. Number three, we have anemia, which is low red blood cell count, which can be as a result of heavy bleeding. That's why above we have said we can use transnamic acid to improve the clotting time of blood to avoid this anemia. We have urinary tract infection, which can come as a result of what we call ascending infection due to the continuous bleeding. We have kidney infection, which can also be as a result of the ascending infection, which can occur through the cervix, in the walls of the uterus, or through the cervix. It enters the urethra, then all the way to the kidneys, causing kidney damage, but it's in rare cases. We have infertility, which is also in rare circumstances. This marks the end of our video today. Tomorrow we will be discussing about the complications of fibroids in pregnancy. Let's keep the support on. Let's continue subscribing, sharing our videos, and commenting so that they may reach as many people as possible. Thank you for the support. Have a good night all.